Right. Now, fenbendazole gets attacked because it's a medicine commonly used. It's a dog medicine. It's as they call it, a dog dewormer. Yeah. And yet it's got an excellent safety profile, just like mebendazole. I can tell you, having advised over 1,000 patients on the use of ivermectin, fenbendazole, and mebendazole, there's this myth that the fenbendazole and mebendazole are difficult on the liver, that they can damage the liver, and so on. They can raise the liver function tests, liver enzymes, and it's quite rare. It's very rare. I just don't see it.
But if it did happen and you stopped the drugs or reduced them, the liver's got remarkable powers of regeneration, hasn't it? So.
Well, absolutely. So if you do get elevated liver function tests, and I see it in less than 3% of patients, right. I see elevated liver function tests. You stop it for a few weeks, and those liver function tests, if it was the fenbendazole or mebendazole, they go right back down to normal. This has been published in peer-reviewed literature as well, that there's this sort of transient, you could almost call it an irritation of the liver in a sense, where you get this sort of transient spike in liver enzymes. You stop it for a few weeks and it comes right back down.
And then you can start again.
Exactly. And again, excellent safety profile established, and really just, I've seen some incredible responses. And I combine the ivermectin with either a fenbendazole or mebendazole. I do a combination.
There does seem to be a synergistic effect there, doesn't there? But look, can we look at the doses first of all? So I've been treating worms with mebendazole for probably about 40 years, 100 milligram tablets. So what sort of doses of mebendazole and fenbendazole might you be using for various types of cancers?
A typical dose I suggest is 1,000 milligrams a day, split in 2 doses.
And that's the same whether it's mebendazole or fenbendazole. Exactly.
So either 1,000 of fenbendazole, and the Stanford case series that you had talked about on another program, they had done 1,000 milligrams of fenbendazole. I believe it was 3 days on, 4 days off, and achieved remarkable success, achieved remission from stage 4 cancer.
So 3 days on, 4 days off.
Yes, so that was what the group of patients were doing at Stanford. I tend to use 6 days on, 1 day off, a little bit more aggressive dosing, and same thing with mebendazole, 1,000 milligrams, 6 day on, 1 day off.
1 day. Is that just to give the liver a bit of a break?
Exactly. You give the liver a bit of a break, and again, incredible results. Now you could go less. You could go either 500 of fenbendazole and 500 of mebendazole if you're dealing with a low-grade cancer, maybe a very early-stage situation. I have a lot of patients coming to me with early-stage prostate cancer. Maybe they don't want the surgery and radiation therapy, and they are looking for a way that they can maybe shrink the tumor or get rid of it altogether without having an intervention and the risks of those interventions. So you could do lower doses, like 500 milligrams of mebendazole.
For how long?
Again, I design my protocols for 3 months, and I've done this with ivermectin and fenbendazole and mebendazole, and it's roughly the same idea. Is you can start to see changes in cancer markers in about a month. It takes about 2 to 3 months to start seeing shrinkage of lesions, and typically oncology patients, especially when you're dealing with active disease, chemotherapy, immunotherapy, they will have follow-up imaging every 3 months or so, and so you will automatically have that imaging from your oncologist. If not, I encourage patients to make sure that they have imaging follow-up from their oncologist. And so you can see after 3 months or after 6 months if there's been a response to the lesions. And so I had a situation recently with a breast cancer patient who had, her surgery was delayed for whatever reason, and she had several months of wait time to her surgery. She had a 7-centimeter breast tumor. By the time, so she was taking ivermectin and mebendazole. By the time her surgery came around, and there were some enlarged lymph nodes as well. By the time her surgery came around, the tumor was less than 3 centimeters, and there were no positive lymph nodes, where they were certain that there were going to be positive lymph nodes based on the imaging appearance. So she had shrunk her tumor by more than half and managed to eliminate some of those lymph nodes entirely by the time she had her surgery. And this was a matter of maybe 3 months.
It's amazing. So in things like breast